Wes, the dental guy here, and I was doing some training for some people, and I decided, hey, I've got my surgical cassette out. Many of you know that John and I do place dental implants, and one of the setups that I've had for about 13 years now has been this. Now I've added and subtracted from this as I've changed my practice, but let's open this surgical cassette up. This video is not sponsored by anybody, but this is a Hugh Freedy surgical cassette. It's what we use for our implants, surgeries, our surgical extractions, bone grafting setup, the whole bit. So I do have, for retraction, I have a standard mirror here. You can see I've got this particular handle on that, just what I prefer for surgery. Set that out to the side. Also for retraction, Minnesota cheek retractor. And we have other retractors that we use, but we see here we've got a regular size curette. Now I feel good about this curette size. If you look at this model here, this is a model that I've used to kind of do some training with, and you see it fits down inside of a premolar extraction site pretty good. So curette, I can use this to place bone or curettage a socket. So I like that curette, and this is a Hugh Freedy CL85 if you're wanting to note that. Also bone rasp. I like something that has a crosshatch pattern, as you can see here, and I like that for smoothing off ridges, maybe edentulous sites that have little bone spurs. And then something recently that I picked up here in the last year from Salvin is this bone placement tool, and it's made out of titanium, has a nice little curve to it. Maybe you can see that right there, and that's so you can pack bone around implant space and jump that gap like we talk about. Just a standard perio probe for those wanting to kind of be more precise about your surgeries. And then I have like a root tip pick or some type of I would use this more for an extraction, going around and kind of opening up that bone. Some surgeons sedate their patients. We don't with IV sedation, maybe nitrous, maybe a little bit of Valium or something like that. But then this is used to go around the teeth and kind of separate that PDL a little bit. You can kind of work your way around the tooth a little bit. And then if there is any fragments down in this site, you can go down in there and get it with that. And then, of course, a molt or a periosteal elevator. One would say, what is the hole in the end? That's used for my assistant so that she can push up against the tissue, a flap, and then maybe take a, if you had a needle and you would run it through there, you can run it right through that hole. Comes in really handy there. And then soft tissue forceps. These kind don't have the little tissue grabber things on the end, but they are serrated. I've really enjoyed using those. I use a standard pair of rongeurs. A lot of times with good elevation and getting rid of that, opening up that PDL a little bit, this is all we need sometimes for an extraction. And then just a couple little elevators, two very small elevators. You can see these aren't very big at all. And then needle drivers, pretty particular about these. These are pretty delicate. These are pretty expensive. These are I don't even know what brand these are, but I know that they're quality. They last a long time. Then cotton pickups for reaching and grabbing for things. A couple pairs of scissors to cut membranes, and then a stainless steel high vac, and then surgical suction. One thing you got to do is you got to keep this tip really clean. You of course can hook bone traps on there, but what we know recently about bone harvested from sites using implant drills, it's not really that great. And then suture scissors. You can see these have that little suture tip right there, so you can just slip that in there and give that a cut. Then stainless syringe, and then a scalpel blade. We all like to cut with cold stainless steel. This one has a nice little measuring tool on the end. But that's pretty much it for Wes the Dental Guy. We keep everything in these cassettes. They've tended to have kept my instruments really nice and clean. So this has been Wes the Dental Guy. If you have any questions, hit us up on Facebook or Twitter. You can find us on iTunes. Give us a thumbs up there, and I appreciate everybody and all that they've done and following the dental guys. Thank you.